I have the unenviable task of interrupting all these conversations that are going on. It's always nice to host one of these events and see people mingling and meeting people that they want to meet and talking about issues they want to talk about. Before our next speaker comes on, I have the job to introduce a video that we wanted to show you. First, I just wanted to call out, in all of your packets, you've heard me talk about feedback-informed care. You heard Glenda talk about measurement-based care. I think Chuck mentioned it as well. And in our packets is a one-page that says feedback-informed care. That just describes our approach to what we're talking about here, measurement-based care, and the idea that we can bring intentionality and measurement to mental health care. And I thought Glenda put it very well, which is we need to know what works in order to know where to devote our resources. And the good news about that is that is now. That's not a future state. We do know how to measure that, and we do know what we can do with that data, and we're learning more all the time. So take a look at that. So this video is just a short video on October 13th as part of Kaiser Permanente's efforts to raise the profile of mental health in our communities. We hosted a forum in Northern California where we had about 250 community partners, as well as Kaiser Permanente providers and other key employees. And it was about building resilience in our communities and focused on mental health. We had our chairman, Bernard Tyson, who many of you have mentioned to me as, he is really out there forward on this issue. If you look at his LinkedIn pages, he's posting things about mental health all the time. It's really exciting for us to have the CEO say, this is an important issue among all the issues that he has to pay attention to. So we appreciate that. We also had our Northern California Health Plan President, Janet Liang, there. We had Patrick Kennedy, as you'll see. We had Gayatri Ramprasad, who's a mental health advocate. Some of you may have seen at the California NAMI statewide meeting. We had Daryl Steinberg. Somebody had actually mentioned the $1 billion a year that we have in California for mental health. Daryl Steinberg, when he was in the California Senate, authored Prop 63, which generated that income on an ongoing basis. We did panels on resilience through family and peer support. How do you develop resilience in the workplace? And we also had a youth panel, which was really fun, and you'll see a little bit of that as well. So at the end, we talked about a $2 million grant that we're supporting to sponsor investment in stigma reduction, trauma-informed care. That's just in our Northern California region. So if we could roll that video, we will get going. We all know somebody, love somebody, care about somebody, work with somebody, or are somebody who is dealing with a mental health or addiction condition. We want people with mental health conditions and the people who care about them to find their words and break the silence together as a community.
Part of our work is simply to reconnect the head to the rest of the body. And for us to be able to talk about mental health and mental issues as fluidly as we talk about heart disease and cancer and kidney disease.
We are not prepared in this country to address the epidemic that is surrounding us all across this country of mental health needs. And what we need to do is prepare to repurpose the rest of medicine to do mental health care. Kaiser Permanente is going to set the model for what kind of healthcare system we really want.
We at Kaiser have been working not only in how to advance prevention, early detection, and promotion within the mental health space. And recently, we've been talking about the way to engage everyone is through a public health campaign, and that's why we chose to focus on resilience and stigma.
If Kaiser sets the model, which you absolutely can do because you're already culturally aligned to do integrative care, to do population health. It's in your DNA. I mean, we're at ground zero in terms of really establishing the new paradigm. And thank you for being a leader in this.
Many of us find great success in our own care when we use our voice and we tell our story and we open up to others.
My journey began when my daughter was 12. She began cutting at school, self-harming, and it affected our entire family. since this was a family problem, we all needed family therapy.
Most policymakers don't take on these sets of issues because they fundamentally believe that it's too hard. That it's too hard. That there's no way you can actually make a big difference. If we can demonstrate to people through real outcome-based measures that prevention and early intervention around mental health is the most successful way to avoid all the terrible consequences of untreated mental illness, we will improve homelessness, we will reduce the crime rate, we will help families, and we will make for a much more peaceful and healthy California and United States of America.
At 18, when panic pounded my heart, anxiety coursed through my veins, and my soul was darkened by depression, I had no words to describe my horror. Ignorant about mental health issues, my parents and physicians could not understand my pain. Never in my wildest dreams did I imagine that I would have the opportunity to give hope to thousands of people like myself and my family around the world.
For attending this lecture,
by defining what is a
focus
community.
your attention on your breath.
Mental health is a huge issue. It impacts your emotional state. It impacts the way I show up in the world, the way I go for something or not. If I can imagine something happening, then I can achieve it.
Keke Palmer is a modern voice for a modern world.
I wish to break the curses of ignorance in my family, especially in terms of mental health. The passion grew not only through my love for my family, but my love for people. Social media truly allowed me to see that so many young people like myself are struggling with anxiety, depression, BPD, borderline personality, and have no idea or even know their trigger points.
Thank you so much for being here and being so open. What made you decide to use your platform for this particular purpose?
My message would be that you're not alone. I know it feels that way, and it really, really feels so real. You could be in a room full of people and you feel completely and utterly alone. But you're not, and that it gets better. The whole point is sticking in there for another day and allowing yourself the opportunity to see that it gets better.
Either your immediate family, your extended family.
Your number one priority.
All that you've gone through.
This issue does not stop when we leave the room. So I am really pleased to announce that in 2018, Kaiser Permanente will be investing $2 million in communities across Northern California to address the issues of reducing stigma and increasing the public awareness of mental health and wellness.